I'm Steve Smith, and welcome to the Lucky or Good podcast. This podcast invites reflection and dialogue following outdoor and experiential education events. Why do we normally succeed, but sometimes fail? What can we learn from successes, near misses, or incidents? Through non judgmental analysis, we uncover lessons for outdoor and experiential education programs as we explore the sometimes fine line between lucky and good. I'm very grateful and excited to welcome today's guest, Shana Tarter. She is the managing director of the University of Colorado School of Medicine's Diploma in Climate Medicine and a past president of the Wilderness Medical Society. She previously served as the associate director of Knowles Wilderness Medicine and chaired the Wilderness Risk Management Conference Steering Committee. She was also a wonderful contributor to my 2021 book, Beneficial Risks, and for the past 3 decades, she's taught and written on wilderness medicine and organizational risk management, now working at the intersection of climate, health, and the unique challenges of operating in remote environments. Great to have you on the show, Shana. And I believe you're here today to share with us a topic that's affecting all of us, but it's not clear if we've been getting lucky, if our luck is running out, or what good exactly looks like. So, welcome to the Lucky or Good podcast. Where would you like to start?
Well, I think I'd rephrase that opening. I think I would say that we are at the precipice of having the opportunity to be good. So we actually don't have to ask this question in the same way in the future. I mean, I think our conversation today really, for me, tries to frame how do we avoid being an incident on your podcast in the future? I think we have a lot of places that we can actually make some proactive organizational shifts that will help us manage risks that we have not historically been managing.
Okay, great. So, what are some examples of that? What are some examples of ways that organizations might be getting caught right now?
I think, one of the things about climate change is we're all experiencing it. I'm sure that we could all find some list of anecdotes in our personal or professional lives where it has impacted us. And in fact, in the outdoor industry a few years ago, some colleagues and I put out a survey to try and assess what were those impacts of climate change on our industry. We anticipated the results that we got, which is that the impacts are here today and they are already disrupting programmatic operations. What we didn't anticipate was the magnitude of the impacts. And so when you look at some of the data that we pulled, you have stats like 86% of the outdoor programs that we surveyed said that they had had a new impact from heat compared to the previous 3 years. 82% said that they had had new impacts secondary to air quality degradation compared to the previous 3 years. And yet, 12% of those programs said that they were being proactive in their efforts to deal with these new and intensifying risks around climate change. And so I think that that gap between the impacts are here and they're of a significant magnitude, and the lack of shift towards actually operationalizing a program for what we know is coming gives us that's our risk exposure right there, right? And so we've seen certainly early indicators of this. There's not a lot of incident data yet, which is great, but you've seen early indicators of heat related illness. I mean, step outside our industry, look at high school athletics, right? You've got programs where high school sports are continuing to operate in their status quo in the same seasons, in the same conditions, and you're having athletes getting sick and dying from heat exposure. You have changes in vector-borne diseases and people getting illnesses that historically weren't present in those communities. And so when we talk about sort of luck or good as a dichotomy, we know these impacts are coming, and yet we are not making the pivot that we need to make so that we don't have to ask that question.
Mhm, mhm. Yeah, the question itself is a dichotomy that is sort of a false one in the sense that we can be lucky and good. And I think that what is interesting in this climate change topic for me is that our luck may be doing us a disservice by leading us to maybe not pay attention to some things that we should be as you point out, proactively paying attention to. And it may not be as clear to people what good looks like. What is the best way to understand this? It's interesting because it's a slow moving threat compared to something like a tiger attacking you or something that you can visually see. We respond pretty well to fast moving threats. And as a species, we have not done a good job of responding to slow moving threats. So, on the one hand, it's a slow moving threat. And at the same time, it's accelerating and it may not be slow moving for much longer.
You highlighted the core issue, which is that the change is slow. I mean, that's slow is a relative
Mhm,
statement, but
mhm,
in the way that we operate kind of in a season to season kind of capacity, the change
mhm.
is relatively slow. And the impacts that we see are really just leading edge impacts. An isolated incident here, an adjacent industry that has an incident over there. But they're not, we're not in the middle of the bell curve where we need to be actively responding on all fronts. And so I think that one of the cardinal mantras of climate change, if you will, is that the past is no longer a reliable predictor of the future. And yet our brains are wired on pattern recognition, right? And so we look historically for the patterns that govern the decisions that we make. I need to purchase a new piece of machinery for my business, right? And so you purchase a piece of machinery that's tailored to the conditions that you have known to have to expose that piece of machinery to. You don't say, in 20 years, the average temperature is going to be significantly hotter. Will this machine that I hope I only have to pay for once every 30 years be optimized for a condition that exists 20 years from now? Because it's very hard to imagine an environment that you haven't yet experienced. And so I think this is part of the gap that we're seeing or in the lag in preparedness is that we are still assuming that the past historical pattern is what we are going to have to manage in the future. And so we go along and we make small incremental changes in our programming, but we don't wholesale say, what if, what if I can no longer access this operating area? What if the temperatures don't allow me to operate? What if the pollen season is so long that all these kids can't go outside at camp anymore because they just feel lousy all of the time? What if flooding, washes out the single ingress and egress road that I have to my operating area? What if wildfire smoke prevents me from going to the places where I hold permits to operate my business? And it's only through really pushing at those what ifs and reevaluating the risks that you manage as an outdoor program operator on a daily and a seasonal or an annual basis and recalibrating your program to operate in that new risk environment that you're going to actually this shift.
You mentioned one thing there that popped out for me, which is the idea of an organization that might be locked into some things, decisions that they already made a long time ago, owning a
Hmm.
property in a certain place or being committed to some schedule of programming that is during the high summer season, most likely to be affected by climate change because their model is working with kids that are out of school or something like this. They are locked into some things that make it harder for them to imagine the pivot. And so there's some problem with their mental model itself, their baseline assumptions on which the entire program or the operations sit. And it brings up for me this idea of sunk cost bias, where we already own this base camp in this part of the forest in the Southern California. And
Hmm.
so we have to continue to deliver programming there. And the question I think that you're raising, is it so? Do we need to continue to indefinitely into the future do things the way that we've always done them? And so I'm bringing up sunk cost bias as one example of a mental model that may not be serving us here.
Well, I think absolutely, and I also think that there's identity that's tied up into
Hmm.
this. Take a summer camp in Southern California, right? That has been operating a family business. It's been operating for 75 years. There's an identity tied to that camp and who they are, the ethos of their programming, how they deliver on their mission that goes back in that case generations, right? And this idea that we could still maintain our identity if we changed how we delivered on our mission, that's very hard for people to move their thinking around unless you are forced to. And I think this is where I think a lot about incentives. So I am a total Freakonomics podcast junkie. It's my favorite. But I think one of the core tenets of behavioral economics is that knowledge and education don't tend to drive behavior change, right? We see that throughout. Like we all know smoking is bad, and yet people still smoke, right? Or pick anything in that genre. But just knowing that something is a poor decision doesn't make us make a different decision. We tend to need to be incentivized to make an alternative decision. And what incentivizes us? Peer pressure incentivizes us, financial risk incentivizes us. Fear of loss tends to
Hmm.
incentivize behavior change. And so this idea of
Hmm.
you're right, like people they have sunk cost, and we know that generally investing in prevention is cheaper in the long run, but investing in prevention comes with upfront costs that aren't in the annual budget, aren't supported by your leadership team, aren't necessarily supported by your board of directors. And so this idea of how you make the argument that says we do have to invest now, or we will not be able to deliver on what we want to deliver in, the numbers are arbitrary, but 5 years, 10 years, it means that people are caught in the moment. And I mean, we all experience this, right? You have these strategic things that are always on your to do list that you're like, someday when I have time, I'm going to think about this really important, complex topic because I'm going to give myself a day, a week, whatever, and I'm going to work through this really hard problem. What happens is your inbox fills up and you deal with the things that are right in front of you right now. And we don't have anything pressuring us to close down our inbox and go over to these really complicated strategic business decisions that we need to make. And sadly, what's going to happen is there's going to be a catastrophe for an organization or for our industry that's going to be our COVID pivot, right? We're going to have programs. I mean, Helene did this in part, in part of our country, right? You had programs physically damaged. We saw this in, the bushfires in Australia 6 years ago, right? You had programs physically destroyed and they had to literally build back from the ashes. And we don't want to get there. We know enough to know that now is the time to say, plan A is what we have always done, right? We know how to do this really well. We know what the risks are. We know how to mitigate those risks. But what we need to be doing right now is to say, well, let's make sure we actually know all of the risks, right? If you operate a program in the southern United States, in Florida, California, Arizona, Texas, is dengue on your risk profile? There are locally acquired cases of dengue across the southern part of the United States. So when you go out, are you taking mosquito precautions at all times to make sure that your participants don't get dengue? Is that on your risk form? Is that part of your risk talk? Do parents have any idea that that's a possibility? So I mean, dengue has been a risk in the world for a while, but it's a new risk potentially geographically for programs. And so that idea of like, we have to take what we do, we have to sort of upskill our conversation around risks, what's new, what's intensifying. And then we have to say for every day in which we operate, what if we can't do that today? What do we do? Maybe we go outside normally and the air quality is very poor one day. Do I have an indoor option? Do I have another location option? And it is a lot of work to replan every day of your operating season, to replan every trip of your operating season with a backup plan. But it is a lot more work to do it in the moment when you
Hmm.
haven't thought about what your backup is. And that we saw this in COVID, right? That's how we burned out staff. And that's how we burned through our financial reserves because it was impossible to develop backup plans because the dynamic landscape moved too fast. But here we have that opportunity. And so now is the time to invest the time and the resources to make sure that you know what your pivots are so that you can still deliver on your mission and not interrupt your revenue stream.
So you brought up dengue. Let's just use that as an example to explore a larger topic about risk assessment and what is our mental model of risk assessment. A traditional approach would be to identify the hazards that you're anticipating for this program, and maybe you chart them in terms of their probability and their severity, and you use this risk matrix in order to manage risk and to allocate resources and plans accordingly. Or maybe you're using it to justify a decision that you've already made, which is that the trip is running on Monday and we need to justify that we have identified and managed the risks, right? In other words, does a linear approach to risk assessment service as well as we would like to think that it does in this topic?
Yeah. I think the way I might kind of reframe what you're asking is to operationalize that question.
Mm.
So I think we historically have a pattern that you just described, which is at any sort of the outset of any program, we kind of do we run down our list of risks and factors and we decide, the tires on the bus are good and all the participants are here and they all have a signed release form and we've checked all of the equipment, right? We run through all of our risk mitigation strategies that are correlated with the risks we expect to experience on the program. And then we get a green light or red light, whatever we get, but generally we move forward. And it's kind of a one and done approach. And I think what we need to be doing in these environments that are dynamic and where the risks are potentially novel to the area or to the trip leaders that are supervising participants is we need to constantly be reassessing the environment in which we are operating. And I think one of the really significant changes that certainly in all of my decades in outdoor education, there was this sense that we imbue a lot of trust in our outdoor leaders. We believe that they are skilled at situational awareness and that they will generally make reasonable decisions with the information and tools that they have available to them. And I mean, I think that's still a great premise in which to operate. But the reality is that this on the ground situational awareness with climate related impacts is only part of the picture. And anymore, to actually make these ongoing risk assessments, we need to blend the information that folks have from the sort of local perspective. I'm in the field. I can tell you what the conditions are like with the more global perspective that our whatever your base camp or administration or office is, because blending forecasting with experience allows us to actually make a much more informed decision. It's very hard and stressful if you have a group of people under your responsibility and you go to bed and look at the stars and you wake up in the morning and you are in a cloud of smoke and there's ash deposited on all the tents around you, right? We know that it's very hard to tell where is that ash coming from? Is it from 3 miles away over the next ridge? Is it from 300 miles away? You don't have that information in your localized situational awareness, but your ability to collaborate with somebody who has access to that kind of data and forecasting will help you make a decision that says, boy, there is physical immediate risk due to fire, and we need to take this group out of here. The air quality is going to stay poor for the next 3 days. We're going to continue on our route, but we're going to ask everybody to wear masks or some other scenario. But we really do need to combine the micro and macro viewpoint in order to get a full risk assessment. And I know for a lot of people, that just continues to erode at this sense of autonomy and the beauty of being in a wilderness. But you and I were around during all those early screaming conversations about whether we should have technology in the field and how it was going to absolutely ruin the industry. And here we are. We've normalized, to use a word that we like to talk about, right? We've normalized technology and everybody accepts it as an appropriate risk mitigation tool. And I think we need to start thinking about this idea that collaboration between the people on the experience and the people with access to forecasting needs to be normalized as a part of our decision making.
Which interestingly is a lot more easy for us to do with the technology that you
Of
just referred
course.
to, by the way. So it's all, these are systems that are sort of affecting each other. If you are using an approach like that, that it's best not done as a performative thing, but more as a living dynamic document that is being revisited and reevaluated and utilized and perhaps informed not just from what you can see from your camp, but informed by people who have more information than you might as well.
And I think there's a next part of this too, which is often the decisions like the go no go decision that we make on the front end of an experience. Those are, I mean, they're never simple, but they are easier because we're not there. We're not out in a remote setting yet. So if we delay by a day, if we adapt our activities and be indoors for a few days because of poor air quality, like we can do that. It is very hard to make those decisions when you're out there and there is this environmental change, right? We know the complexity of moving groups long distances or getting groups out of the field, this false reliance on air support to get people out of the backcountry.
Hmm.
Like we know all of those things. And so I think one of the other real developments that we need to make as an industry is come to some kind of collaboration or consensus on how to make those complicated decisions in the moment. Maybe we see more portable air quality monitors being carried in the field. And that's so I wake up that morning and there's ash on the tent and the AQI monitor says 153. What decision does that data prompt? And how are we going to make those decisions? And I think programs are starting to wrestle with some of that, but I don't think we have an industry consensus.
Sometimes with the go, no go, like, question, I think we may even oversimplify that because green is easy, right? The green situation is easy, and the red is kind of easy. So if it's really clearly, but it's living in that yellow place. And the question of not yes or no, but how? How do we move forward? Or how do we stay at this campsite? Or if we retreat into some contingency plan, how do we do that? And so, that's the place where I feel like more collaboration and programs sharing their stories and their success stories are not just waiting for the tragedy to occur and not just looking at the pieces that are wrong, but can we learn from the things that are going well? And I'm curious if you have examples in your mind, either real or hypothetical, of what would good look like? What would it look like for an organization to be doing this well?
Sure. I'm going to move us to the concept of a simple model that I
Mm,
think can help organizations along the continuum towards good, if you will. So after we put out that survey and got those pretty alarming results about the lack of preparedness and all of the narrative that went along with the responses to that survey basically said people knew this was a problem. They were confounded at how to start and they faced that same challenge that the inbox was always full and there was never time to really deal with it. And then there was also this general sense of lack of support from the upper leadership and a sense that the operators on the ground should just be able to figure this out. And so all of that, when you're overwhelmed by all of those factors, you go into avoidance mode. And so you just move on to the inbox and you don't deal with the big issues. And so I think the idea is that we have a lot of tools that we're already pretty good at as an industry. And so risk assessment is one that we just talked about, right? And so I think, a good exercise to go through with your program staff, your trip leaders is to go back through all of those programs. And this, because this is maybe added into the briefing part of your program, this is maybe added into your staff training. But we need to, review what new risks exist, what risks are intensifying, and whether we have appropriate strategies. So, Reb Greg's famous analyze, manage, and inform, right? Are we analyzing our risks? How are we going to manage the new risks? And importantly, are we informing our participants, our staff, and our families? So I think that is a tool set we have. And that is what people can do. And I think that there are a lot of climate related risk forecasting tools that are available to the public. Or states and counties may have risk forecasting tools. Your insurance broker may be able to access through your insurance provider different risk forecasting tools. Things like we talked about dengue, right? Vector-borne diseases moving to new places, and so those you can get those through various health departments. And so I think all of that is don't wait for the incident to say, "Oh wow, I had no idea dengue was in Los Angeles," but be proactive on the front end. I think this idea of operational resilience and really to me that's the have a plan B for everything you do, right? It's great when you never have to use them, but if you know the name of the bus company that you're going to contract when you can't do plan A, but you need to do plan B, and now you're going to go over to this other venue, and you've had a conversation with them ahead of your season that says, how much notice do we need to give you before you'll be able to serve us? And you've got a contract ready to go. Great, that's good. That's not lucky that you get lucky on your sixth call to a bus company. That's planning. I think the emergency response plans need to potentially adapt from this collaborative decision making to this concept of always on communication. Our historical norm has been the no news is good news. So, people go off into the outdoors and we don't hear from them until we pick them up a couple of weeks later. And we were very content operating in that capacity for many, many years. But I think we need to be shifting towards this always on, whatever always on comms looks like that to you. That could be a check in, at 5 o'clock every afternoon with the group. That might be a reasonable cadence, but that allows the folks in your administrative side who are accessing forecasting information every day to say, conditions are about to change.
Mhm.
And we need to make a decision that helps you adapt to these changing conditions. But you can't do that if you're in the like no news is good news style of interaction. I think this idea of education and informed consent, right? This goes back to you have a mission and whatever X experience is, there's always been some sort of pinnacle event. Maybe you spend a week backpacking and you climb a particular peak at the end of this week. And that's always been the way you've done it. And you're looking ahead and saying, I might not be able to operate in that area. Um, and therefore, I can't do that event that for years and years and years, everybody has talked about. Like, that's the cool thing you get to do. So, how do you get in front of that with your participants, with your families to say, this is our mission? These are the values and opportunities we're going to provide to our participants. We're going to try and deliver our mission through experience A, but we care a lot about the health and safety of the participants, and we are not going to push that envelope. And so if we can't deliver it through experience A, we're going to go to experience B. And we want to be upfront with you that that's why we're doing this. And this is how we're going to have open dialogue and communication with you so that you know what to expect from us. And that's good. That's not lucky. Like that's pre-planning. And then I think the other thing that we often the kind of the unglamorous part of what we do is what we sort of loosely call enterprise risk management. We have to look at the existential threats to our organizations. I mean, the financial resilience is really was the Achilles heel of so many programs during COVID for good reason, right? It was very expensive to bring a program through COVID. But I mean, I would challenge any outdoor program to say, in the next 5 years, let's just assume that you're going to, for at least 1 month, you're going to have to operate with no revenue and your full cohort of expenses. And I think a month is conservative, but let's just say a month, the next 5 years. How much cash, how many days cash do you have in the bank? Can you do that? And if not, looking good on your continuum looks like, yeah, we are actually contingency planning to the point where we can shut down for a month, can do whatever we need to do and lose revenue for a month and have the financial resilience to come back from that. We can operate in an underinsured capacity because a lot of our programs are doing that right now because premiums have gone up so much and effectively manage $100,000 expense that isn't covered by our insurance premiums or our deductible because we chose to take the premium deduction knowing that we had the $100,000 to deal with whatever we have to pay for and we can still continue to function. So it's kind of those 5 points of like redoing your risk assessment, being operationally resilient, rethinking your emergency plans and communications, looking at your informed consent and making sure that all these new climate and health risks are part of that conversation, and then having good operational resilience. That's how we get good moving into the future.
That's really helpful 5-step guidance. And this podcast and our industry reaches out not just to large organizations with lots of staff and resources, but also tiny little organizations who may not be as equipped with resources or the gift of time. What would you like to say to the industry in general about doing business as usual versus taking this proactive approach that you're describing?
I mean, at first, I would just want to acknowledge that what you just said is a reality, right? I'm not stating that this is simple, and I think as a result, a lot of organizations are going to do exactly what you described, which is they're just going to do iterative small change, and for a while, you're going to get away with that because I think we do operate generally well thought out programs with a teaspoon of luck in there, and we generally make conservative common sense decisions. So you may get away with that for the rest of your organizational lifespan. On the other hand, you could have a catastrophic result. And we're possessed of the knowledge to actually kind of see what's coming. We know it's getting hotter. We know it's getting drier. We know vector-borne diseases are moving. We know air quality is degrading. And we know all of these things have impacts not only on our ability to just operate, but on human health. So the thing I would say is that you don't want to gamble on the health of your participants. you are always going to have to go through a risk benefit assessment for your organization. And anytime we take a risk with participants, we need to disclose that to them and their families have to have an informed consent. But I think that's the murky world we're looking at. We know what these risks are, but we don't know what our tolerance points are. You know, I was reading an article this morning and saw that there's a new word a new word in Japanese, kokoshobi, which means cruelly hot day. And it is a definition of a day that's over 40 degrees centigrade or 104 degrees Fahrenheit. So our language is evolving to reflect these changing climatic points that we are going to face.
Well, Shauna, you've shared so much with us today, and I've learned a lot from you, as I always do. I'm imagining some of our listeners who might be program directors or folks who have responsibilities for risk management in their organizations. And I'm wondering what your advice would be for some first steps or some things that they should be prioritizing to move forward.
So I would say at the leadership level, I would start with that question that I brought up a little while ago. If we had to shut down for a month, sometime in the next 5 years, how many days cash do we have in the bank? And is it enough? From a programmatic level, I would engage your staff and your sort of programmatic staff and your field faculty. And I would go through an active exercise with every program you're running this summer to take a look at that risk matrix and ask yourself the question, what's new? What's a new risk? And what's a changing or intensifying risk? And for each of those bullet points, have a corresponding mitigation plan. And then I think the third thing is this great intern project. Have somebody look at all of your public facing materials. Call that your risk and release form, all of the marketing you have on your website, your health forms, with an eye towards do those risks that you identified, like potential operating in poor air quality, have we picked those up in our public facing information? Does that trickle through to this person has a history of asthma? Maybe we ought to, we don't usually see asthma on the shoulder seasons, but maybe we will now. So are we talking to this person about those new risks? So really go through and do an audit of your public facing materials and make sure they reflect the climate as it's changing and the risks that you will soon be facing if you're not already.
Where can people go to keep learning about all these topics and stay connected to the great work that you're doing?
Well, if folks are interested, we have a LinkedIn group called the Wilderness Climate Lab, where we try and post a couple times a week, and we talk about resources, we talk about this particular climate resilience plan, we try and bring in articles, and really, we're just trying to get the industry aligned along this conversation. We regularly present at the Wilderness Risk Managers Conference, and there is I mean, you can Google climate and health, and you could find a webinar a day if you want to learn more about the specifics of any of these issues. But from an outdoor industry perspective, um, encourage you to join the Wilderness Climate Action Lab LinkedIn group and participate in the conversation.
Fantastic. Well, Shauna, I've learned a lot from you today, as I always do, and like to really thank you for being here with us. And thanks to all of you for listening. And remember, despite the show's title, we can be lucky and good, but relying on luck is not an effective risk management strategy. So let's keep sharing our stories so we can earn our luck. If you enjoyed this episode, please share it with your friends, subscribe, and if you'd like to be a guest on our show, you can learn about how to do that at luckyorgoodpodcast.com. Thanks so much.
Thank you, Steve.